In this module, we'll discuss how to create a learning environment that will inspire and motivate our trainees, that will provide the atmosphere in which they can successfully learn and grow. The learning climate is the atmosphere. It is always there, and we as educators play a large role in determining whether our learners feel like they are in a desert wasteland or in a lush, supportive place. Let's acknowledge that there are realities in clinical medicine that may threaten the learning environment. High patient volumes, productivity expectations, system factors, but let's also empower ourselves to manage that which we can control by using some of these specific strategies to create an effective learning climate. Let's consider 4 domains of the learning climate that attendings influence. First, enthusiasm for patient care and learning, respect for our learners and others in the clinical setting, role modeling, humility, and balancing challenging and supporting our learners. If we continue this metaphor of growth, our job is much like a farmer. We can't make things grow, but rather we provide the environment. We plant the seed, often at our first meeting with learners when they get their first impression of how their time with us will go, and then throughout as we continue to fertilize their growth or not. Let's start with enthusiasm. Some ways to demonstrate that are introducing yourself, talking about what your interests are in clinical work, and displaying a positive attitude towards patient care and learning. So here are some sample phrases that accomplish those aims. Explicitly saying, hey, it's great to work with you this week. My area of interest is inflammatory bowel disease, so you'll see me get excited about that. And enthusiasm is infectious, so call out interesting cases. Tell them about your favorite patients and make explicit statements to really celebrate the wins. Showing respect for your learners is easy. Use their name early and often. If you're uncertain about accurate pronunciation, just ask. Saying your name correctly is important to me. Can you please pronounce it? Or check that your initial pronunciation was correct. Respect for learners also entails considering the individual differences that might affect how they engage in the clinical setting. Note this doesn't excuse lack of engagement, but rather how they engage. Learners who tend toward extroversion and who are fast auditory processors may be easy to engage. So we as attendings may need to be mindful of allowing space for quieter students or those that need a little time to think, or folks who process data more visually or by writing notes. They may still be learning and growing, but it just looks and sounds a little different, and that's okay. So let's look at some specific phrases that help show respect. Make that first impression by saying, Deborah, great to meet you. Tell me about your goals for this rotation. And keep fertilizing the seed. Deborah, when you're a radiologist, this will be important. Deborah, what do you think about this? And finally, make it okay to say, take a moment to think. Next, we must show humility, acknowledging our own limitations, create a safe space for questions, and make it okay to ask for help. This not only creates space for learning, it also keeps patients safe. So in your first meeting or an introduction email, say, I don't know everything. We're all here to learn. Ask for help when you need it. And call out when you all have a tough case, saying things like, that's a good question. Let's look it up, to role model that lifelong learning. And don't be afraid to talk about the times that maybe you've missed something. Finally, we should seek to balance challenge and support. Challenge them to improve, to develop new skills, yet support them through uncertainty. This can be accomplished by giving both reinforcing and constructive feedback. This chart demonstrates why this is so important. With low challenge, our learners are stagnant or experience confirmation of mediocrity. Yay, you showed up and your socks match. Whereas all challenge and no support leads to fear. So we should strive for just enough challenge to grow and enough support to know they can be successful. Specific ways to strike this balance on first meeting is acknowledging that this may be hard, but your job is to challenge them, no matter where they are, even if they're good, to help them be great. And then on an ongoing basis, fertilize by saying, okay, you got this part right, now add on this, or I really want you to commit to your plan. Now let's look at a few attending behaviors commonly identified by trainees that might poison the learning climate. One is interruption. Let's look at this example of an intern presenting a case to the attending, rolling along, super efficient, and before the intern can describe the abdominal exam, the attending interrupts. Was his abdomen rigid? And the learner is thinking, well, if you'd have just given me 3 seconds, I'd have told you. Yes, there may be time pressures in clinical care. Acknowledge that and set expectations ahead of time for how much information you want or how much time you have to discuss this case. Try not to interrupt. Then, if needed, give feedback about how to present more concisely next time. What nonverbal cues are you sending to learners? Imagine being this student here on the right, presenting to an attending who is phone scrolling. How would that feel? Like you are distracted or disinterested. There may be times when you need to check an urgent message or maybe look up a lab data, but explicitly tell learners or have them pause. Another environmental poison often cited by trainees is that terse or tense attending who may have conflict with others. Ways to prevent this is, at least outwardly, role modeling interprofessional teamwork for our learners. Yes, there will be frustrations in the clinical setting, but our learners want us to vent to peers, not to them. We also have all experienced differences of opinions between two specialists, but that's an opportunity for us to highlight how two great doctors from different fields might have unique perspectives, and that's okay. Learners also love when we show appreciation for folks from other disciplines. Instead of complaining about nursing, let us thank them, brag on how good our office staff are, and how great the techs are in our departments. Learning climate. It's the air we breathe. It's all around us all the time. By being mindful of how our words and actions impact our learners, we can create an environment for them to grow. Demonstrate enthusiasm by talking about why you love your job. Show respect by using names and considering those individual traits. Model humility by making it okay to say, I don't know, and find that crucial balance of challenge and support. Being mindful of the tone that we set with our learners will help create space for them to not only to survive, but to thrive.